your question. Right. So if you have read and understood, considering the critical care scenario, please tell me how would you manage this patient?
I will manage the patient according to HLS protocol and go for ABCT approach.
Okay.
First of all, airway.
Yes.
I will check the airway and do cervical spine control. First, I will assess the airway by first looking into if there is any foreign body present or not within the oral cavity, or any kind of maxillofacial injuries there or not. And I will look for any accessory muscles of respiration is used or not during respiration. And then I will feel for patient's breath on cheek, and I will listen to any stridor or any wheeze present or not. And after assessment, I will manage the airway. I will first, if the patient is able to speak, I will assume that airway is patent. If not, I will clean the oral cavity. If any foreign body, I will remove it, and either by suction or any kind of solid debris can be removed by forceps as well.
Yes.
And I will do simple airway, basic airway maneuvers like
Right.
oropharyngeal or nasopharyngeal
What
airway.
measures would you take to make sure that patient is breathing difficult, having difficulty, and their vitals are unstable?
Uh, uh, as patient is vitals are unstable, I will on the on checking the breathing, I will check. I will look for any open wound or any chest injury. And as on primary survey here, it's noted that he has multiple rib fractures. Patient may have pneumothorax or hemothorax, and uh, mm,
All right. How would you make sure or you'll secure the neck of the patient?
I will immobilize the cervical spine
Right away.
uh,
Yes.
by hard collar or
When you are doing
sandbag.
ABC management with the A, as soon as you rule out airway, second thing that you have to do is secure the C-spine
Cervical
injury.
spine.
Yes. Okay. What else would you do? Or what else would you keep in your mind while transporting this patient to the hospital?
What else? Patient is a polytrauma patient. He may have pelvic fracture as well.
Okay.
So
Could be possible, but yes. Yes.
during transfer, I will maintain the log roll approach.
Okay. All right. Yes. What else would you do? What investigations would you do to confirm if patient is having C-spine
Yes.
injury?
I will go for a trauma series X-ray involving chest, cervical spine, and pelvis.
Yes.
And
Yes.
if needed, I will go for fast.
Yes. First of all, you'll do, and then you can do the CT scan. All right. Okay. Can you please tell me what inotropics you can give to the patient? in order to manage or take care of the vitals of the patient?
Inotropics like dopamine,
Okay,
dovitamin, norepinephrine.
okay. While giving these, what you have to keep in your mind
I
while giving,
will
yes,
I will check the vitals repeatedly and
okay,
monitor other factors like heart rate, blood pressure, urine output, patient's mental status, capillary refill.
all right, yes. And how would you manage the patient's multiple fractures, rib fractures and clavicle fractures, foot fractures? When would you take care of those?
Um, Refractures, actually, ABCD protocol is the priority. It is the priority, and
Yes,
as soon as patient's hemodynamic status is stable,
stable, yes,
then I will go for checking the ribs, which ribs are fractured.
yes,
And in case of multiple refracture, I will exclude if any kind of flail segment present or not. And clavicle fracture is also managed after
all
that.
right. Okay. While giving or while managing the patient's vitals, you think of giving any blood or blood products to the patient. What would you choose?
I will choose packed red blood cell.
Okay. What complications do you have to keep in your mind while transfusing packed blood cells?
Complications, common complications are uh, reaction to WBC that is manifested as febrile reactions that may happen, or if there is any mismatch blood group, then maybe a transfusion reaction.
Okay.
And yes,
Right. Can you please tell me how would you define massive blood transfusion?
massive blood transfusion, if patient is transfused uh, more than 50% of patient's whole blood volume within
4
24
hours.
hours.
Yes.
That's called massive blood transfusion.
Yes. Right. All right. Can you please tell me what is the risk factors that you'll keep in your mind while giving the blood transfusion to the patient?
Risk factors. I will screen the donor blood
Yes.
uh, uh, for any kind of viral infections that can be transmitted, and
Can you tell me,
also,
can you describe the mechanism of hemostasis?
yes, ma'am. Hemostasis first, there is vasoconstriction,
Yes.
then platelet adherence and aggregation that leads to formation of platelet plaque, and then activation of coagulation factors
Yes.
that leads to formation of ultimate fibrin plaque.
Can you tell me how does a vessel stops bleeding when you transect it?
Stops bleeding by vasoconstriction first,
Okay, then.
then these are the steps: platelet plaque formation, then fibrin clot.
First of all, it's vasoconstriction and then
Yes, ma'am.
platelets and then factor. Okay, good. Thank you. Yes, almost everything is covered. Good, thank you. Would you be able to read this image for me, please?
Yes, ma'am. This is a X-ray cervical spine lateral view
Yes, good.
showing showing fracture body of fourth cervical
Fourth.
spine.
Yes, good, good. Thank you.